A groundbreaking study released November 2024 as part of the European Cosmos Initiative has intensified calls for governments worldwide to address the potential health risks associated with long-term exposure to radio frequency radiation from mobile phones. The Cosmos France study's findings underscore the need for evidence-based policies, particularly in the United States, to protect public health, especially that of children. Prominent environmental attorney and health advocate Robert F. Kennedy Jr. has been a vocal proponent of stricter regulations on RF radiation. Advocates suggest that if appointed to a leadership role within the U.S. Department of Health and Human Services, Kennedy could spearhead transformative policies modeled after France's progressive approach to mitigating RF radiation risks. Key findings of the Cosmos France study. The Cosmos France study focuses on the longitudinal analysis of mobile phone use and RF radiation exposure among over 25,000 French participants. With an impressive participation rate of 48.4%, the study provides a robust foundation for future health-related analyses. Demographics and participants skewed older, with many over 60, allowing for comprehensive monitoring of chronic conditions that may develop due to RF exposure. Factors such as educational attainment, smoking habits, and body mass index influence the onset and intensity of mobile phone usage. Mobile phone usage patterns. Most participants reported weekly mobile phone use between 5 to 29 minutes, with usage trends increasing significantly over their lifetimes. The study highlighted changes in mobile phone adoption corresponding to technological advancements like the introduction of 2G, 3G, and 4G networks. Technology's impact. Older participants were less likely to use modern communication technologies like Voice over Internet Protocol, emphasizing generational differences in RF exposure. The dataset aligns with the broader Cosmos Initiative, designed to evaluate correlations between RF exposure and conditions like cancer, cognitive decline, and neurodegenerative diseases. Global evidence of RF radiation risks. The Cosmos France study contributes to a growing body of research indicating potential health risks associated with RF radiation. Key studies reinforcing the urgency of updating public health guidelines include the National Toxicology Program study in the USA. Found clear evidence that RF radiation causes cancer in rats, including brain tumors and heart tumors. Highlighted the need for updated safety standards that consider non-thermal biological effects of RF radiation. The Ramazzini Institute study in Italy demonstrated cancer risks at exposure levels comparable to those experienced by people living near cell towers, showed genetic similarities between tumors in rats and human gliomas, reinforcing the relevance to public health. The Bioinitiative report reviewed over 3,800 studies and identified numerous health risks, including increased cancer rates, neurological effects, and reproductive harm. Concluded that current RF exposure limits are inadequate, especially for children and vulnerable populations. France has set a global precedent by enacting precautionary measures to reduce RF exposure, particularly among children. Key elements of France's legislation include Wi-Fi restrictions in schools. Wi-Fi is banned in nursery schools for children under 3. In primary schools, Wi-Fi routers must be turned off when not in use for educational purposes. SR labeling on mobile phones. All mobile phones sold in France must display their specific absorption rate values. Packaging must include instructions on how to reduce exposure to RF radiation. Public access to radiation data. Citizens can access RF emission measurements near their homes, promoting transparency and awareness. Advertising regulations. Advertisements for mobile phones must recommend the use of hands-free kits. Ads must also include warnings against holding phones close to the head. As a longtime advocate for environmental health, Robert F. Kennedy Jr. has emphasized the need for stricter regulations on RF radiation to protect public health, especially that of children. Kennedy advocates for resuming and expanding the National Toxicology Program's research on RF radiation, which is crucial for understanding long-term health effects. He calls for the Federal Communications Commission to revise its outdated safety standards to include non-thermal biological effects, aligning with the latest scientific findings. Kennedy emphasizes educating the public on safe mobile phone practices, such as using speaker mode or wired headsets to reduce exposure. He supports implementing policies similar to France's, such as restricting Wi-Fi in schools and requiring SAR labeling on mobile devices. Advocates urge that the U.S. should adopt France's proactive measures to safeguard children's health. Implementing such policies would demonstrate a commitment to prioritizing public well-being over industry interests. Limiting children's exposure by restricting Wi-Fi use aligns with precautionary principles to protect developing brains and bodies. Requiring SR labeling and providing public access to radiation data would allow consumers to make informed decisions. Government-led initiatives could raise awareness about minimizing RF exposure, similar to anti-smoking campaigns. The Cosmos France study underscores the urgency of addressing the potential health risks associated with long-term RF radiation exposure. As scientific evidence mounts, the debate over mobile phone radiation has evolved from a scientific inquiry into a pressing public policy issue. Advocates like Robert F. Kennedy Jr. emphasize that effective leadership is essential to enact transformative policies. By following France's example, the United States can implement precautionary measures to protect current and future generations from potential health risks associated with wireless technology. Robert F. Kennedy Jr. is an environmental attorney and advocate known for his work on environmental justice and public health issues. He has been actively involved in raising awareness about the potential risks of RF radiation and has called for stronger regulations to protect public health. For more information on RF safety and advocacy efforts, please visit RF Safe or contact John Coates at 727-610-1188.